Thank you, Madam Chair. I appreciate the opportunity, and just for the record, it was slick for 300 miles getting up here. Half of my life has been working in the long-term care facility that my parents started when I was 6 years old. And so I've been around this my entire life, even though our family is not in the business anymore. It still is very near and dear to me. And so as I'm sitting here and listening to all the different things, some things came to my mind. And one thing I wanted to state back to Representative Welter said, as far as the protocol, I realize that there are protocols that we have to follow, but I will tell you this, when my wife and I, when we contracted the COVID, the governor himself found my cell number and called me. We've never had a talk before, and I think that was the first time he left a message on my cell phone. But I just want to say that when the time comes, no matter what's going on, you can get a hold of somebody when you need to. Protocols are very important, and that's how you run businesses, that's how you run a government. But I just want to say that when there's time to talk to somebody, you get a hold of them. So I appreciate the protocol thing, but I also want to say that when there's time to talk to someone, you can get it done. The other thing that concerned me very much before I get to a couple of things I wanted to say is that the gentleman that was on earlier was talking, the question was about the HVAC systems, and said, well, the contractors, they're fitting it in their schedule. I want to tell you this. There was 9 of us kids. My parents started the nursing home, and the place you could eat off the floors, and if you couldn't, my mother went and found the housekeepers and showed them how to clean. My mother was in the laundry room at 6 o'clock in the morning doing laundry because she loved to do it. She was at home doing the books at midnight. In between there, they were running the business. This isn't about me or about Severin Nursing Home, but this is about the emotion of the things that went on. And I want to say this also. Our facility was inspected by the federal inspectors and by state inspectors. And so we used to get nervous when they came on campus, but I can tell you this, as a family-run facility, when they came on our facility, we were proud to show the care that we gave, and we weren't afraid, we weren't concerned. And so what bothers me is this is a state-run facility that we have this pandemic in March. We're in December. We have these things happen in November. What was going on from March to November to start addressing the things? I realized that the major amount of people that contracted the COVID was on November the 1st, but what kind of things were going on? And so my question is this, because I think about the people that are, Representative Swanson, you talk about the boots on the ground, the CNAs, the LPNs, the dietary, the activity department, the social service department, the maintenance, all those different people that are the boots on the ground. I'd like to know, you talked about 3 different categories of staffing: conventional, contingency, and crisis. I'd like to know by shift from March to this day, what were we in? Were we in conventional, contingency, or were we in crisis mode by shift, by facility? I'd like to know that, and also by department. And my other question is this: what is the staff experience at that facility, and what is the turnover rate? Because that is very important. I realize that I've never worked through the fire department, but you can't hire people in the middle of a fire to try to put a fire out. And so I realize that we are addressing these things, but this stuff is very important to me. I appreciate all the different things and all the different specific numbers and dates and all those kinds of things. But what really gets to the heart to me are those kinds of things for the staff that are, we appreciate what they're doing and their concern for the people that we've lost. And I just, again, I appreciate all the different things that you've shared, but I'd like to have the answers to those things. I'd like to know the conventional, contingency, and the crisis by shift, by department, by facility. And I have a VA hospital in my district, and I have the Anna VA facility is actually right outside of my district, but it's close to me. And so long-term care is the heart of me, and I think I appreciate it's the heart of everybody that's in this room, but it's unacceptable, some of these things. Well, we're working, trying to a time frame or whatever. There are some things you just get the job done, and I understand there are other things that does take time, but there's some things we can do a better job of. Thank you.